Hi, everybody. Happy Thursday. Great to see you all. Wherever you are in the world, please grab your chai. I have mine today. And let's talk about this important topic today. Please send this link to a friend who may also benefit from this. We're going to start in about 30 seconds. And let's do it. Okay. As always, please put comments in the chat box so we can answer those at the end. And this is for educational purposes only. And again, we're going to be talking today about a really important topic. If you have a friend who could use this, please invite them, share the link. All right. Okay, so are your periods sort of disappearing? Are you not getting your monthly cycle and you're wondering what's going on? Do I have PCOS or am I in menopause already? This is a common dilemma that patients face, sometimes in their early 40s. And I've seen a few patients this last month with exactly this question. I have not been getting my periods every single month like I used to. I've been reading on the internet and it says I may have PCOS, but then I've also been reading about menopause and maybe I'm in perimenopause already. And what should I do? So, how do you go about thinking about these two things, PCOS and menopause? And what are these two conditions? And what would your treatment look like if you had one or the other? Those are the things that we are going to cover today. So, can't wait to get into it. And so let's start. Let's start with PCOS. PCOS is called polycystic ovarian syndrome. And if you, like most patients, type in, Google, I'm not getting my periods for many months, what could it be? You're probably going to get the answer PCOS or menopause. So the first factor that you're going to want to pay attention to is age. Okay, so how old are you? Now, it gets a little tricky in the 40s, but typically PCOS is a condition that affects women who are younger. So 20s, 30s is the typical age range of somebody with PCOS, maybe early 40s. And then perimenopause or menopause, we're talking more mid 40s, late 40s, and early 50s. Okay, so age is the first thing that you're going to ask yourself, okay, how old am I and what is this most likely to be? Now, if you're 41 or 42, this can get a little muddy because it could be PCOS or it could be perimenopause. And then there are ways to, further differentiate it. So both lead to a lack of ovulation. Okay, so with PCOS, the hallmark is you don't ovulate, and so you don't get a period every single month. And same with perimenopause and menopause. You don't ovulate and you don't get a period every single month. So, again, this can be a little tricky, but age is the first factor that you're going to use to figure out, which camp do I fall into. So if you are 47 and you are slowly starting to space out your periods, unlikely that it is PCOS. But if you're 32 and again, you're starting to space out your periods, it is unlikely that you are in perimenopause. Now, there are always exceptions to these rules, but this is the first factor. This is the first thing you're going to ask yourself. Okay, number two, the hormonal imbalances in both these conditions are very, very different. So, what do I mean? Estrogen and progesterone are the two main hormones that play a role in our metabolism and our functioning as women. So, rises and falls in estrogen and progesterone are what cause a lot of symptoms throughout our life, whether it's puberty, pregnancy, menopause, whatever it is. These are the two hormones that play a very, very intricate role. Now, we also have other hormones like testosterone and cortisol and things like that, but it is the interplay between estrogen and progesterone that has an effect on our cycles, our mood, all of those things. Now, PCOS is a hormonal condition where these hormones are a little bit out of balance, and it almost leads to an increase in androgenic hormones like testosterone. And so you're seeing things like increased facial hair or chin hair or acne, oily skin. These are some of the things that you'll see in PCOS. You can also see, obesity, where you're like, I'm eating well and I'm actually doing some exercise, but why am I, gaining weight? And PCOS is primarily a metabolic condition. Okay. So what do I mean by this? It is not, while hormones do play a role, estrogen, progesterone, testosterone, it is primarily a metabolic condition. So with PCOS, you're going to see things like insulin dysregulation, increase in prediabetes. Maybe your cholesterol is increasing. Your blood pressure could be going up. And so that is how I want you to think about PCOS. So if you're 25, you haven't gotten a period in 6 months, somebody says you have PCOS, and you're like, oh my gosh, yeah, I have increased facial hair, I gain weight, my periods are really off whack now. The next step is to really do a deep dive into your metabolic health. And so to make sure that you don't have diabetes or high cholesterol, because as we know, cardiovascular disease is the number one cause of death in women. And so we want to make sure that we keep those things in check. Now, there are plenty of treatments for PCOS, but it all stems from a metabolic component, how to reverse these metabolic conditions. Now, let's look at menopause. With menopause, there's also a dysregulation of hormones. Estrogen, progesterone, testosterone, same hormones that are, not in balance. But the primary thing with menopause is a drop in estrogen. Okay, so drop in estrogen. So estrogen is a magic sauce of all hormones. And so estrogen, when you don't have enough estrogen, you're going to have symptoms like the hot flashes, sweats, mood changes, inability to sleep, irritability, vaginal dryness, painful sex, urinary symptoms. We have estrogen receptors literally from our head to our toe. Estrogen receptors everywhere, in your eyes, in your ears, like places you did not even think. So their estrogen influences everything in our body. And so when we think about menopause, those are the kinds of symptoms we're going to be feeling. It's not necessarily that you're going to suddenly have high cholesterol or suddenly have diabetes, although with perimenopause and menopause, your cholesterol can go up a little bit and you can gain some weight, which a lot of patients complain about. So again, PCOS and menopause can be a little confusing, but the primary issue in perimenopause and menopause is a drop in estrogen. So number one, you're going to look at age. Okay, how old am I? Am I 20s, 30s, or am I 40s, 50s? Number two, you're going to look at, what's going on. What are you exhibiting? What are you showing? What is your body showing with these hormone imbalances? Is it that you're having increased facial hair, that you're having acne, more oily skin? Now you have prediabetes, cholesterol, all those things. So it's really a metabolic issue versus are you having things like, dryness, hot flashes, sweats, mood changes, things that are a direct cause of low estrogen. Okay, so that is the second point. And the third thing that I want you to think about is, the treatments are also very different from PCOS to perimenopause and menopause. We discussed how PCOS is often a metabolic condition. And so this is something where you may, get on some medications to improve your insulin sensitivity. A lot of patients with PCOS are actually on their road to fertility. They want to get pregnant. Again, these are women in the 20s and 30s, and they're thinking, okay, well, how am I going to get pregnant if I don't know when my period is going to come. It's really hard for me to tell when I'm ovulating because I don't even get a period. So when am I even supposed to try, right? So the issues facing somebody with PCOS are a little bit different, and reversing those metabolic conditions so that you do get your period more regularly is what's going to help you, get pregnant. But it's a whole different approach. Versus for menopause, we're really looking at estrogen supplementation, progesterone supplementation to help offset the drop in estrogen and progesterone from your ovaries. So it's a very different, approach as to how you're going to deal with it. So to recap, if you're somebody who is not getting your period and you're like, do I have PCOS or do I have menopause? Because in both these conditions, you don't get your period for months, if not years, right? So the first and most important thing is age. See how old are you? 20s, 30s, maybe early 40s, or are you 40s, late 40s, early 50s? Age is the first thing that's going to tell you which of these conditions you may be having. If you're 41 or 42, this can be a little bit tricky, but then you go on to point number two, where these conditions manifest very differently. PCOS, with PCOS, you get increased hair, body hair, facial hair, acne, breaking out, plus metabolic conditions where you're having diabetes, cholesterol, high blood pressure, all of these things. Versus with menopause, it's the lack of estrogen that's causing things like hot flashes and sweats, vaginal dryness. So it is the way it presents is very different. There can be overlapping symptoms, but again, this is when you're going to fall back to the age and sort of see where you are. And there are blood tests that we can do to further pinpoint. If it's not very obvious, there are blood tests, imaging that we can do to further pinpoint, what's going on. And number three, depending, on what's going on, the treatment is also very different. So you want to be thinking about that. PCOS, it's not like, oh, great, I don't have my period and I'm worried about getting pregnant. But since it's a metabolic condition, you also want to be paying attention to the high blood pressure, the prediabetes, the cholesterol, and making sure those numbers are all, controlled, because cardiovascular disease is the number one cause of death in women worldwide. And so we want to make sure that we're paying attention to that. And then in menopause, we're more thinking about estrogen and progesterone supplementation, because we want to make sure we're protecting our bones, our brains, our hearts, and really all the tissues in our body, because as I previously mentioned, we have estrogen receptors from our head to our toes. So our entire body is affected by estrogen. So how you think about what you do is very different if you're on the perimenopause, menopause road. So I hope that has helped clarify a few things regarding PCOS and menopause, because sometimes it can be a little tricky. And if you don't think about it with a full picture, it's a little confusing to say, well, am I having PCOS or am I having menopause? Because these treatments are very different, and how they affect our bodies are very different. So we want to get a really good understanding of what's going on. All right. So those are my 3 points for today on PCOS versus menopause. I would love to take some questions. If anybody has them, please post them in the chat. Can you still get pregnant if your period is unpredictable? So yes, absolutely, this can happen. We've definitely seen it in women, even in the early 50s, where they're like, oh, I get a couple periods a year. That's not going to happen to me. Well, it did. These pregnancies are not viable pregnancies. They do end up in miscarriage, pretty early, 6 weeks, 8 weeks. But the point is, nobody wants to have that scare at that point. So yes, whether you're in your late 40s, early 50s, using birth control if you are sexually active is very important. And same if you're 20s and 30s, and if you're like, well, I'm not really ready to get pregnant, but I don't get my period anyway, so I'm just going to kind of coast is not a great option because you never know when you ovulate. And that's the thing with PCOS. You may go months without getting a period, and then you would ovulate and get a period. So good question. All right. Does weight loss really help with PCOS? Yes. Since PCOS is a metabolic condition, even a weight loss of 5 pounds can actually improve insulin sensitivity. Now, the typical picture of somebody with PCOS is somebody who is overweight, but that is not always the case. We have seen patients who are very thin who can also have PCOS. So the answer always is not to lose weight. But to your question, it can help with PCOS. It can help regulate your periods. I've seen patients who've lost 5, 6 pounds and bam, the periods are back and they get them regularly. So yes, it can definitely help. Okay, what lifestyle changes actually help regulate your cycle naturally? I love this question. So the first thing is, watching what you eat. I know we hear this all the time, but as a gynecologist, I'm always talking to my patients about this. We live in a world that has so much processed food, so much sugar. It is, even if you have like really a strong willpower and mindset, it's over when you step out, like you go anywhere and there's just so much junk. So really paying attention and watching what you put into your mouth is going to be key. So really unprocessed whole foods, avoiding uh, processed and lots of sugar, those kinds of things, and then moving, so movement, weights, and getting 10,000 steps or whatever it is that you do to, maybe you're running, maybe you're walking, maybe you're swimming, some cardiovascular exercise. These all reduce blood pressure, these all reduce cholesterol, improve insulin sensitivity. So it's just good advice for us overall, but these actually also help your period come into sync, because your period is like a vital sign. Okay, so just like when you go to the doctor, they take your height, your weight, your blood pressure, your heart rate, and at the gynecologist's office, we say, when was your last period? Because that right away gives us a clue as to what is going on with your health. The period is like a vital sign for women. So the more regular it can be, the better. And there are definitely ways to bring it to that. Okay. Any other questions? What's the best way to track ovulation if my cycle is irregular? Good question. I think the most reliable way, honestly, is to use ovulation test kits. And there are many on the market right now. There's digital ones, but you don't really need anything that fancy. You just need one of those ones that you dip into your pee, and it's either one line or two lines. And there are good brands on Amazon that are actually pretty cheap, where you get like 50 tests for $20. I would look into those. Wandfo is one such brand that I remember from a long time ago. I'm not affiliated with them in any way, but I just remember them doing the job without breaking the bank. Because if you're somebody who doesn't get a period, for 6 months, I mean, you're going to be doing a lot of those tests. So that is the most reliable way to do it. There are more fancy apps now that I've seen patients who, kind of do, they not prick their blood. They pee and then they scan it in, and it gives you all these hormonal levels. I don't love them. I've seen some of the data from them, and they just seem very complicated to understand, and so or follow, and sometimes they're not accurate. And so I think the easiest way is just a ovulation test. Okay, what other questions? I'm only 35. Could I already be going through perimenopause? This is possible. It's rare, but it is possible. I would not put it out of possibility. Now, the average age of menopause is 52. We know that perimenopause can be a whole 10-year span. Sometimes starts mid to late 30s, and then various symptoms through your 40s. Or for other people, it's just sort of a more concentrated 3 or 4 year period with all these symptoms. So it can be different for different people. But if you're feeling some of the symptoms that I talked about for perimenopause, I would definitely see your doctor about that and get some testing and see what's going on. It can be possible. We have seen it. Any other questions? Is it normal to go 2 to 3 months without a period in your 40s? I'm 43. Yes. So this brings up a great point. Just because you miss a period or two, it does not mean that you have PCOS, and it does not mean that you're in menopause. Sometimes you just miss, a couple months. Ovulation can be changed. That cadence can be altered for many reasons. Sometimes people are undergoing a lot of stress, or they started some new medication, or they're traveling, or they moved somewhere else and their whole routine is messed up. There can be many reasons why you miss a couple of months. Now if this is happening regularly, or this 3 months now becomes 5 months, then I would get some testing. I would see your physician. But if you go 2 to 3 months and then everything starts back up again, I wouldn't worry about it. Menopause is defined as 1 year without a period. So just so you guys know that one too. Okay. Can stress really mess up your cycle this much? I sometimes get my period on random dates, but it is still every month. It can. It can. So it depends, if you're talking about 3 to 4 days. So for example, if you get your period on the first of every single month, and then 1 month it's on the third, 1 month it's on the 28th, it came a few days early. That's all still within normal duration. So every 21 to 35 days is still considered normal. But if you're getting your period on the first, then you get it on the 15th, then you get it on the 28th, and then you get it on the first again. So if it's sort of broken up like that or irregular, then there could be something else going on, and I would get care for that. Okay. Anything else? These are really great questions. I hope you guys share this episode with a friend, a colleague, a relative, anybody that you've heard talk about irregular periods, or as women, we talk about everything, right? So and you're thinking, oh, this person could really use this information, please share this with them. If you are anywhere in California and you want to talk more about your health and what's happening with your periods, please make an appointment with us. We can do a virtual visit, a video visit. If you're anywhere in California, I'm in the Bay Area. If you're local, come and see us in the office. And if you're anywhere in the world, and outside California or anywhere in the world, and you just want a session to go over more, in more detail, your health, I can't be your doctor, but I can definitely coach you through some things. You can also set that up with our office. Again, I'm Dr. Prabhakar, board certified gynecologist, and happy to help you guys. The Urogyne doctor says, thank you. Thank you. Thank you. Again, please share this episode with a friend in your world. I would be so grateful. Have a beautiful Thursday, everybody. Have a great weekend ahead, and I will see you next week. Bye.